Missouri is in the midst of distributing the COVID-19 vaccine, as we all know. Can you tell us the priorities of DHSS in this distribution?
Yeah, Megan, thank you so much, and thanks for what you're doing communicating. We think it's just so vital to what we're trying to do. Our priority is always the most vulnerable. And I define that if you had two people, and we know by either demographic or risk factors that the person to the left was more likely to get sick from getting COVID, as opposed to the person on the other side, that's the person that we want to make sure gets the vaccine. And in Missouri, that's people over 65, and that's about 1 million people, and then about another 1 million people who have what we call comorbidities: heart disease, cancer, pregnancy, Down syndrome, and type 2 diabetes. And so that is very much our prioritization. Now, in the first tier one, phase one, we very much were focused on long-term care facilities and residents, because we knew that that's where 40% of our mortality was coming from, even though they only made up 4% of the cases. So we've moved through that phase. We also were very conscious about our healthcare workers who take care of those people, because they're like the pilots of the plane. If the pilots of the plane get sick, then everybody else behind them is in big trouble. And so now we're into Tier 1B, or Phase 1B, and Tier 1 is again those other healthcare workers, first responders, people who are vital to trying to keep people, EMT, safe. And then Tier 2, which again is people over 65 and older, and the 1 million with comorbidities. So that's where we are.